Well, May is National Stroke Awareness Month, and stroke is the leading preventable cause of disability in the United States. We're joined this morning by Dr. Kelly Matmati from the Rochester Regional Health Stroke Unit. We thank you so much for joining us. We're talking about the symptoms of stroke, how to realize or recognize those symptoms, and what would you say is the most important thing for people to be on the lookout for?
So we use an acronym to remember the signs and symptoms of stroke. FAST, F-A-S-T. The FACE stands for facial droop. A stands for arm weakness or numbness. You can also have leg weakness or numbness. S is for speech changes, which can be slurred speech or difficulty with finding the words. And T is for time, which means time to call 911 and get to the hospital quickly.
Will you always have all of those? Could you have 2 out of the 3, 1 out of the 3?
You could have any of those symptoms. There's also some other symptoms not covered by the acronym. You could also have sudden onset of vision loss, particularly on one side. You could have sudden onset of severe dizziness or balance problems as well.
Okay, that's terrifying. And so some of these things might be confused for other things, like, you know, for other situations, and people might not think, oh, I'm not having a stroke. But when we talk about stroke, I mean, it can be fatal. I mean, you know, it's not something to even take lightly ever, is it?
Right, and you should really, if you have these symptoms, you should call 911, get to the hospital immediately. Don't drive yourself there.
Yes.
And there are treatments that we can do for stroke, especially if we catch it early. There's a medication called TPA that if we give it through an IV, it can help stop the stroke or limit the stroke if we catch stroke early within 4.5 hours of last known normal. There's also another treatment option called endovascular stroke therapy, where doctors can go in with a catheter and try to pull the clot out of the brain and stop the stroke.
That's
It's
crazy.
very sci-fi almost,
you guys weren't
right?
doing this maybe 10 years ago, right?
It's a very new therapy, yeah.
Yeah.
And that happens here in our community.
Yeah.
Yes.
What kinds of strokes are there? There's different kinds of strokes, right?
Right, so the most common kind of stroke is an ischemic stroke, which is basically a blood clot is cutting off blood supply to part of the brain and causing that part of the brain not to get enough oxygen and nutrients to survive. There's also the bleeding kind of stroke in which you have a burst of a blood vessel into the brain and can cause some of the same similar symptoms.
What are the risk factors do people need to be aware of to lower their own risk of stroke?
The most common risk factor is high blood pressure. Also, cigarette smoking is a risk factor, diabetes, and other things like heart conditions, and just age. As we get older, we're at higher risk of stroke.
Yeah.
Are there certain things you should start doing? Sometimes at certain ages in life we should start doing certain tests or talking with our doctors about certain things. Is there anything like that for stroke, or sort of your overall health picture?
So certainly see your primary doctor on a regular basis, even if you think you're healthy. Get your blood pressure checked. I think that's probably the most undertreated preventable cause of stroke that we have.
Blood pressure?
Blood pressure. There's a lot of people walking around with very high blood pressures that think that they're perfectly healthy because they feel fine.
The thing about blood pressure, you don't feel it. It's not like you can say, I'm having a stressful day, my blood pressure is high. People, that's one of those silent illnesses, right?
Definitely.
Silent conditions.
Yeah, so it's very important to get your blood pressure checked, and if it is high, to get it treated.
Yeah.
Okay.
This is incredible. Again, so it's FAST is the acronym.
Right.
Right, so face, drooping. The A stands for?
Arm weakness.
Right.
Leg weakness too.
Right.
Leg weakness,
S
yes.
stands for?
Speech.
Slurred speech, and then T is time.
Right.
As soon as if anyone tells you they've got those symptoms, call 911 ASAP.
Absolutely.
Like right away. Yeah, this is great.
Good reminders.
Thank
so
you,
much
doctor.
To keep in mind. Thank you.
Thank you so much. Great to know, too, that there's those improvements in care for stroke. Really is. Thank you so much. We appreciate it.
Thank you.
All right, coming up, Deb Bernanke from Happier at Home is here talking to us about elder abuse, what it is, what are some other warning signs, and what you can do about it.